I told you there's a wellness tool that could help you sleep better, improve your mood, reduce stress, support your pelvic health, boost your libido, and ease menopause symptoms? Yet it's been wrapped up in shame for far too long. I'm talking about vibrators. Stay with me here because what we're about to explore isn't just about pleasure, though pleasure absolutely matters. It's about your health, your vitality, and your right to feel good in your body. Welcome back to Pleasure in the Pause, the podcast dedicated to empowering midlife women to connect to their bodies' pleasure and power in perimenopause, menopause, and beyond. I am your host, Gabriella Espinosa, and it is my pleasure to be here with you. Today, we're having a conversation that I'm very excited about. We're talking about vibrators, not as taboo objects or guilty pleasures, but as legitimate wellness tools backed by research and designed to support women's health. I invite you to approach this episode with curiosity and a beginner's mind. What if you could set aside everything you've been told or assumed about vibrators and simply ask, how can this invite more pleasure into my life? What if there's something here worth exploring? Whether you're brand new to vibrators or you've been using them for years, there's always more to discover about how they can support your well-being and deepen your connection to pleasure. This episode is grounded in science and completely shame-free. Sexual wellness is essential wellness. When we ignore it, we miss out on real health benefits that could change how you feel every day. Today, we're going to explore the research, bust some harmful myths, discuss different types of vibrators, how to choose the right one, and why they make great gifts. So let's dive in. We all know that midlife brings hormonal shifts, estrogen, progesterone, and testosterone decline. And with that, your body changes. And with those changes come uncomfortable symptoms such as vaginal dryness, decreased libido, difficulty with arousal, sleep issues, mood changes, and stress. Here's what doesn't get talked about enough. Sexual wellness and these symptoms exist in a powerful feedback loop. When you nurture your sexual wellness, you're actually influencing sleep, mood, stress levels, and physical comfort. When you experience pleasure, your body releases dopamine, oxytocin, and endorphins, hormones that regulate mood, lowers cortisol, and helps your nervous system shift from stress to ease. Pleasure increases blood flow to the pelvis, strengthening your pelvic floor, supporting tissue health, lubrication, and sensitivity. This isn't about performance. It's about supporting your body through a major transition with tools that work. And vibrators are one of the most effective tools we have. Let me share some compelling research that honestly should be discussed in every doctor's office, but rarely is. In 2024, the Kinsey Institute surveyed 1,178 women in the US, ages 40 to 65. They wanted to understand how effective different menopause symptom management strategies actually are, such as lifestyle changes, hormone therapy, supplements, and you got it, self-pleasure. The findings were remarkable. Women rated self-pleasure at 4.35 out of 5 for symptom relief. That's higher than diet changes, exercise routines, or supplements, which ranged between 3.89 and 4.06. Only hormone therapy ranked comparably at 4.2, and yet very few women in the study were actually using it. So what improvements were women actually experiencing? Among perimenopausal women using self-pleasure for symptom relief, 43% reported better mood, 13% improved sleep, 13% increase in desire and pleasure, and 11% improved lubrication. Overall, 46% experienced relief in at least one menopause-related symptom. And here's the part that stood out. 66% said they would self-pleasure more often if they knew it could help. And 57% would be open to it if their healthcare provider recommended it. Yet only 7% of perimenopausal women and 4% of postmenopausal women reported that their doctor had ever mentioned self-pleasure as a possible strategy. Why aren't doctors talking about this? Well, let's be honest. Self-pleasure is still wrapped in cultural shame. Many of us grew up with the message that good girls don't touch themselves there, while it's perfectly acceptable, almost expected, that boys and men do. That double standard doesn't just influence our attitudes, it directly affects women's willingness to access something that could genuinely support their health. And then, of course, there's the healthcare side of it. As I shared in episode 70, Is Silence Costing You Your Health? Only about 25% of medical schools teach sexual health in any meaningful way. And around 80% of physicians won't bring up the topic unless you initiate it. So, of course, women aren't hearing about this. Most healthcare providers don't feel informed or confident talking about sexual wellness, let alone recommending masturbation as a form of symptom relief. But ladies, we can take matters and pleasure into our own hands, literally. And I get the resistance. I had my own resistance to self-pleasure for most of my adult life. I didn't grow up hearing language around bodily autonomy or self-pleasure. I always thought it wasn't necessary or something women like me actually did. And I didn't really start a self-pleasure practice well into midlife, not because something was wrong, but because I finally allowed myself to explore without judgment. And I started slowly. I cut through myths like this will ruin intimacy with my partner or this replaces connection. I cut through the shame that so many of us inherit. And what I discovered was that self-pleasure wasn't taking anything away. It was expanding my pleasure repertoire and supporting my changing body. That's the shift I want more women to experience. Self-pleasure doesn't diminish intimacy. It can actually enhance it. It's not a sign something is broken. It may simply be a tool your body now benefits from. And this is where vibrators come in as wonderful tools to enhance our pleasure and well-being. Let me share with you why. The Kinsey Institute didn't stop at that survey. In 2025, they partnered with a sexual wellness brand on a follow-up study where 66 peri- and postmenopausal women ages 40 to 75 tracked their symptoms while intentionally increasing self-pleasure using vibrators. After just 4 weeks, about 93% reported at least one menopause symptom became less frequent. And the biggest improvements were sleep quality and mood. And this part is important. Orgasm was not required. Women who reached orgasm often reported greater relief, but consistent stimulation alone was enough to create meaningful change. And what's fascinating is that the Kinsey findings are not happening in isolation. We actually have earlier research long before this study that looks specifically at vibration as a therapeutic tool for women's sexual function and pelvic health. So I want to highlight two important pieces of evidence that deepen this understanding. Back in 2018, researchers led by Dr. Jackie Rouleau reviewed decades of scientific work dating back to the 1940s and found consistent associations between vibratory stimulation and improvements in sexual desire, arousal, orgasmic response, and overall sexual function. But it goes beyond sexual function. Vibrators have also been used alongside pelvic floor therapy to support muscle function, urinary symptoms, and vulvar pain. The authors argued that vibrators should be considered therapeutic aids, even medical devices, not just novelty items. The challenge, however, is that because vibrators aren't formally part of standard medical treatment, standardized recommendations don't yet exist. More recently, in 2024, Dr. Dubinskaya and colleagues examined vibrator use as part of a structured protocol across a diverse age group of women. Participants followed a simple vibrator routine over 3 months, and researchers found improvements in sexual function, pelvic floor comfort, vaginal atrophy symptoms, and even possible improvements in urinary urgency and incontinence. Women also reported improvements in overall well-being and mental health. Now, this was a small study, 79 women enrolled and 53 completed it, so more research is needed. But the authors concluded vibrators may act as rehabilitation or maintenance tools for sexual and pelvic health. Here's what all these findings point to. Women using gentle external vibration for just 5 to 10 minutes a few times a week experienced improvements in blood flow, tissue responsiveness, lubrication, muscle tone, and comfort. No penetration required. No orgasm required. Just intentional stimulation. The real takeaway here is that pleasure isn't separate from our well-being. It's part of it. Sexual function, responsiveness, lubrication, desire, these are physiological processes. When we care for them, we're caring for our overall health. Self-pleasure and vibrator use are not fringe practices. They are accessible, low-risk wellness strategies that can improve quality of life at any stage, but especially in midlife. So why do vibrators work so well, especially for women in midlife? Let's start with the star of the show, the clitoris. The clitoris contains over 10,000 nerve endings, more than anywhere else on the body. The clitoris exists purely for pleasure, and vibrators stimulate these nerves with consistency and intensity that hands or mouths can't match. It's not about replacing intimacy or human physical contact. It's about accessing sensation. Here's something crucial that should be common knowledge, but often isn't. The clitoris is the primary source of orgasm for 80% of women, not the vagina, the clitoris. Only 20% of women orgasm from penetration alone. That means 80% of us need external stimulation. Vibrators work with how women's bodies actually function. And in menopause, clitoral sensitivity often decreases with declining estrogen. Tissue becomes less responsive. Arousal takes longer. What used to work might not work the same way anymore. This is exactly why vibrators become so essential. When you use a vibrator on your clitoris or on the external vulval area, you're increasing blood flow to the clitoral tissue and to the clitoral network. You're activating nerve pathways. You're encouraging the tissue to engorge and become more sensitive. You're supporting natural lubrication. All of these things create the conditions for pleasure and arousal to happen more easily. Think of clitoral stimulation as ignition for your arousal. It wakes up your entire system. It brings blood flow to the whole genital area. It signals to your body that pleasure is happening, which then creates the biological response. Lubrication, sensitivity, engorgement. That makes everything else feel better. For many midlife women, penetration without adequate arousal and clitoral stimulation can be uncomfortable or even painful. But when you start with external stimulation, when you take time to build arousal through clitoral stimulation first, everything changes. Your body becomes receptive. Lubrication increases. Sensitivity returns. pleasure becomes accessible again. Beyond clitoral stimulation, vibrators offer benefits throughout your entire pelvic region and nervous system. In menopause, we know blood flow to the genital decreases overall, causing dryness, discomfort, and reduced sensitivity throughout the vulva and vagina. Vibrators increase blood flow to all these areas. It's like a workout for your genital tissue, keeping everything vital and engaged. Vibrators also benefit your pelvic floor. Vibration relaxes tight or tense pelvic floor muscles, which is especially important if you experience pain during sex or difficulty with arousal. And when you do orgasm, your pelvic floor contracts and strengthens. You get this beautiful dual benefit: relaxation and strengthening, improving comfort, bladder control, and confidence. There's also something called pain gate theory. Essentially, your nervous system can only process so many signals at once. And when you introduce vibration, a pleasurable sensation, it can actually interrupt and override pain signals traveling to your brain. If you experience pelvic pain, vulvar discomfort, or tension during sex, vibration helps by replacing those pain signals with pleasurable ones. It's a natural form of pain relief built right into how your nervous system works. Bottom line is, external vibrators are often the best starting point for women in midlife because they work with your body's physiology. They compensate for hormonal changes, restore sensitivity and responsiveness, and make orgasms more accessible, reliable, and a little bit more intense, especially important when hormonal changes affect arousal. So many of us in midlife wonder why our libido has left the bedroom. And no, your libido isn't broken. It's just different. In menopause, spontaneous desire often fades, but desire shifts toward responsive desire, built through touch, sensation, and connection. This is where vibrators help. When hormones decline and your body isn't as responsive, you need reliable stimulation. Vibrators provide that. They increase blood flow, supporting sensitivity, arousal, and lubrication. They help your body remember pleasure. And a strong pelvic floor improves sensation, so regular vibrator use strengthens those muscles, which feeds back into desire. There's also confidence. When you've felt disconnected from pleasure, reconnecting is powerful. Discovering you can still feel pleasure, still have orgasm, that restores confidence and reminds you you're still a sensual being. Vibrators don't create desire from nothing. They reconnect you to sensation, and sensation is the gateway to desire. If you feel your libido is lost, maybe it's just waiting to be reawakened through a different pathway. But let me be clear here. You know, I'm not about always chasing orgasms. The goal is exploration, sensation, curiosity, discovering what feels good now. But orgasms can be a wonderful side effect. And when they happen, they're doing remarkable things. During orgasm, your body releases dopamine, oxytocin, and endorphins. These are natural mood regulators. They reduce cortisol and help you feel balanced and grounded. Many women sleep better with regular orgasms. That's because orgasms soothe your nervous system. They also help with irritability and emotional reactivity, heightened during menopause. Physically, each orgasm strengthens your pelvic floor, supporting bladder control and pelvic health. Regular orgasms increase lubrication and support immune function. And emotionally, orgasms enhance confidence and self-esteem. They improve your relationship with your body and remind you you're capable of deep pleasure. In midlife, when many women feel disconnected, this reconnection is profound. So while we focus on exploration and sensation, When orgasms happen, they offer nervous system regulation, pain relief, restoration, and a reminder of your vitality. I'd like to clear up a couple of myths that keep women from experiencing these benefits. One myth you may have heard of is that vibrators replace partners. No, vibrators are tools that enhance pleasure, whether solo or partnered. Using a vibrator means you're taking responsibility for your pleasure. Many couples find that vibrators deepen intimacy, improve communication, and make sex more satisfying. There's less pressure, more pleasure. If a partner feels threatened, that's an invitation for deeper conversation about pleasure and trust. A vibrator isn't competition. It enhances intimacy. The second myth I'd like to talk about is the one that says using a vibrator causes permanent numbness. False. There's no permanent numbness. Your nerve endings are incredibly resilient. Vary the intensity of the vibrator, switch patterns, take breaks, and listen to your body. This myth is rooted in shame and misinformation, not science. So let's leave it behind. So let's talk about choosing a vibrator. Remember, there's no one size fits all. The key is understanding your preferences. So ask yourself, what do you prefer? External or internal stimulation, or perhaps both? Do you like gentle or intense vibrations? Do you prefer to use a vibrator solo or invited into the bedroom with a partner, or both? Do you prefer something that's small and discreet or something a little more powerful? Is budget a consideration? So let me walk you through the different types of vibrators. First, we have clitoral vibrators designed for external stimulation. They offer bullet vibes, air pulse stimulators, finger vibes. They're excellent for beginners and the 80% who need external stimulation. And then we have internal vibrators, which are shaped for internal G-spot stimulation. They're often curved with tips to access the G-spot. They have rabbit vibes for dual stimulation, or they have thrusting or rotating vibes for more advanced play. And then we have wand vibrators. These are powerful and versatile. Used externally on the clitoris, the vulva, nipples, anywhere. These are your classic wands that deliver deep vibrations, and some of them are even travel-friendly. And then we have wearable and app-controlled vibrators, which are newer to the market. They offer hands-free or partner play. So you have vibrators that look like rings that you can just discreetly place over your vulva. You have little mini vibrators that you can insert into your panties and that you can control with an app for long distance use. Like I said, there's all kinds of styles and vibes for your personal taste. So what you want to look for is material safety, body safe silicone or glass only. Avoid jelly, rubber, or material called TPE. Noise level. Do you want it to be quiet, discreet, or powerful? You may have to consider privacy. And then additional features. Waterproof. Do you want to use it in the shower, in the bath? Is it rechargeable? Does it have multiple speeds? Is it remote or app controlled? And then finally, budget. Quality options exist at every price point. The key is to start somewhere. This is all about exploration and fun. Once you've chosen your vibrator, let's learn how to use it well. You want to find the right time and space, privacy, comfort, no interruptions. This is your time. And start gently. Begin on the lowest setting. Explore different speeds, patterns, and areas on the body. You can place the vibrators on your clitoris, on your labia, just at the entrance to the vagina, on your thighs, nipples. Allow yourself to follow sensation, not a script. And try different positions on your back, on your stomach, sitting propped up on a pillow, standing in the bath. Position changes everything. So again, get curious and explore what works for you. Next, use lube always. Water-based lube works best with silicone vibrators, so don't skip this. And finally, include your vibrators in partnered play. Use it during foreplay, oral, or penetration. They enhance connection, not replace it. The goal, again, isn't performance. It's about curiosity, exploration, and pleasure. And here are some quick care tips for your vibrators. Make sure you clean before and after every use using a toy cleaner or a mild soap and water. And make sure it dries completely. Charge properly. So after each use, make sure you charge it. Full charge before the first use and don't overcharge it. Store it safely. Store it in the bag that accompanies it and make sure it's in a cool, dry place. And most importantly, listen to your body. If you experience pain or discomfort, stop. Do you feel some temporary desensitization? And take a break. And finally, be patient and have fun. Your body may not be used to the vibrations at the beginning. So you're slowly and gently waking up nerve endings that may have been dormant for a while. So if you don't feel anything at the beginning, that's something. Feeling nothing is something. Take a little break and then come back to it on another day. The key here is to slowly build up the sensitization to the vibratory power of vibrations. I always say that vibrators are good vibes that keep on giving. Vibrators make incredible gifts. They communicate your pleasure matters, your well-being matters. You deserve to feel good. They promote wellness, encourage self-care, support you through menopause, and enhance intimacy and communicate empowerment. You can gift one to your partner, close friends, and most importantly, to yourself. Self-gifting is powerful self-love. Make sure you consider consent, comfort, and partnership dynamics. But given thoughtfully, a vibrator honors someone's right to pleasure and vitality and fun. And speaking of gift, I've created something special for you. My Intimacy Holiday Gift Guide. Refined essentials for the modern woman reclaiming her pleasure. It's a curated collection of intimate wellness tools, sensual rituals, and body-centered luxuries supporting your return to sensuality, deeper intimacy, and feeling fully at home in your body. Inside the Intimacy Gift Guide, you'll find my favorite vibrator brands for midlife women, lubricants, arousal oils, and pelvic wellness products and sensual essentials. Whether you're shopping for yourself, a partner, or a friend, this guide will help you feel informed and empowered. Remember, your pleasure is not a luxury, it's a lifestyle. You can find the guide on my storefront on the Shop My website. The link is provided in the show notes. Thank you so much for being here with curiosity and openness. Remember, your pleasure is powerful. It's not frivolous or selfish. It's vital to your health and your right to feel good in your body right now. You deserve sensation, connection, and joy, not someday, but now in this season of your life. I hope this episode gave you practical tools, busted some myths, and reminded you that exploring pleasure is self-love and empowerment. Want to help me spread more pleasure this holiday season? Share this episode with a friend who needs to hear it, and check out the Intimacy Holiday Gift Guide when you're ready. I'll see you next week for another episode of Pleasure in the Pause. Until then, remember, your pleasure matters. The information shared on this episode of Pleasure in the Pause is for educational and entertainment purposes only and reflects my own experience, ongoing research, and conversations with medical and sexual health experts, as well as the lived experience of the women I support. This content is not intended as medical advice and should not replace guidance from your healthcare provider. Always consult a qualified medical professional before making decisions related to your health, hormones, or treatment options. Thank you.